It's a great pleasure to be with all of you, and I want to thank Amitabh Bachchan for just giving your support to this most important subject. Because every time you come up here and speak about healthcare, it enhances the visibility. So, Pranoy and Amitabh ji, thank you very much. Coming to the aspect of what we're looking at, what do we want? We want universal health access for people. And this is enabled through a combination of things. We need more beds. We need more healthcare workers, whether they're doctors. So we have to double our doctors, triple our nurses, and grow by 4 times our paramedics. So this is the infrastructure piece. Then we need to enhance our efficiency. So whether this is automation, we're working on artificial intelligence, we're working on rural enablement, new devices so that doctors can see things. Sitting in a city, they can still diagnose and treat a rural patient. And we've been working across all these realms. So whether it's drones or 3D printing, all these will enhance efficiency and effectiveness. And the third very important pillar is really the focus on prevention. Because when we hear of a friend who's had a bypass surgery and they cleared 4 vessels, or they had an angioplasty and put 5 stents, the question we should be asking ourselves is, where was this individual when his first vessel got partially blocked? And why can't we find them then and treat them medically? When we find cancer, 63% of cancers in our country are detected in stage 3 and 4. If we find them at stage 1, we can treat it cost effectively, with less pain, and definitely with a lower mortality. So this is really the broad framework of looking at all 3, and many of the wonderful solutions you've been talking about come into that categorization. So while coming back to the question you directly asked me on number of beds, number 1, we have to create deeper incentives towards putting up hospital beds in healthcare. And some governments are doing that. There's an interesting plan which has come up called viability gap funding, because beds in rural areas are not attracting the investment. So how do you enable that to do that? At Apollo, we've created a model called REACH, which is the Rural Empowerment and Access to Quality Healthcare. So rural models like these need adequate support, more funding, and then we have to find ways to encourage doctors and medical students to really be in those areas. On top of that, we put telemedicine layers, we put drones, we do local manufacturing, the whole Atmanirbhar, so that we can bring down the cost of treatment. And then finally, to push Ayushman Bharat so that the affordability comes in. So it's a combination of solutions. I think our country is moving. We have many things to be proud of, especially in terms of, high-end care. I want to end with just one very nice story of a young girl who spent 14 years of her life viewing the world upside down, because her neck, her cervical spine was completely 190 degrees circulated. Our surgeon found a way to change the vertebral column and enable her to see life looking straight. And this young girl is from Pakistan and has gone back to tell this story. So there are fantastic things that Indian doctors can do. Let's all work together towards enabling this for our country and for the world.
It's wonderful news to hear. And
Dr. Reddy, if I can just ask you here, tell us, we're talking about technology and innovation. What is, Apollo Hospitals, when we talk about in the tertiary care sector, what has Apollo done? What are the new innovations? Can you share that with us, please?
So there are multiple things, but thank you for this question. So again, you look at innovation or new technology, number 1, on where you can do further diagnosis. So the latest CTs, the latest MRIs. One of the things we've done now is moving to software as a diagnostic tool. So our artificial intelligence tool enables us to look at the risk scores and therefore predict who is going to get sick. And if you look at this in the context of an Indian population of 1.3 billion people, if we're able to stratify those who are at higher risk, we can focus more on them. So that is one thing. The other is in terms of treatment. So our proton is one of the latest technologies in the country, actually the first one in Asia, which is enabling us to treat cancer patients and get better outcomes. So there's a range, whether it is the robotic surgery. So we have a large number of robots which are enabling our doctors to do better surgery. So technology is getting combined and infused into every aspect of care. And then we do things like technology in the room. So to really optimize a nurse's time. You know how many times a nurse gets called into a room to say, I want water, or when is the doctor coming? So we have an equivalent of an Alexa type system and a protocol so that a nurse is called only for medical things and non-medical questions. So this is a method of automation and enhancement of a nurse's workflow. So we're using technology across the board, but ultimately I always say that, you know, while we do high tech with AI and ML and all the amazing things, and use technology, whether it's the bytes or the bandwidth, or even to decipher the genome. These 3 Bs of biology, bytes, and bandwidth are changing the way we look at healthcare. But high tech must always be combined with high touch. So that human touch, that ability to stay close to the patient, to reassure the patient, I think is a fine art and a talent that Indian doctors must continue to hold close.